Some pretty basic advice for anybody who does not want to get this disease, not the washing of the hands. We're all doing that, but some other things that we can do. Tell me about that, and then I'm going to tell you the advice you gave me once. Go ahead.
So a lot of people are curious about this is the time that they're going to go out in public. And all these keywords, boosting your immune system, reducing inflammation, getting the right diet, etc. What should we do at this point? A lot of this already you know. We've spoken about the fact that exercise, meditation, hiking, even 20 minutes 3 times a week can boost your immune system. Many years ago, we spoke about the effect of sex, believe it or not. The fact that studies have shown that sexual activity can boost your immune system and your antibodies, and that's very effective. Making sure that you stick to a healthy diet. Again, lowering your fatty food, carbohydrates, adding a lot of antioxidants, berries, eating chia seed and avocados and salmons are very helpful. But the main ticket right now, there are 2 things, Greg, I want people to know. One is garlic, which is like a big star because it really boosts your immune system and reduces inflammation. And the other one is vitamin D. And studies after study shows that having enough vitamin D is very important to boost your immune system. So those are very important tips.
Well, I remember, look, when in the past, when I've heard doctors and people say that stuff, I really, yeah, whatever. Everybody knows that. I thought you were just saying that. But you told me about the exercise part, and it changed my life about 10 years ago, and I really turned things around. The stuff you just said actually makes sense. All right. Now it actually works, I should say.
I'm glad you're in great shape. And I'm glad that you took care of that and you're in best physical shape, which is excellent.
Thank you very much.
I'm happy for you.
Your large part of that's free, thanks to you.
Testing.
I am thoroughly confused by the testing issue. Democrats primarily, some Republicans, but Democrats primarily are saying this is the issue right now. And I'm a little bit suspicious because if I get tested and I'm negative, so what? I can still get COVID-19. And after PPE was a huge issue, then ventilators, now they're not. The testing issue has some staying power. Try to just unmuddy it for us if you could.
I think it's a big confusion even among doctors because we have different type of tests. Remember, we started with the swab test, which is the PCR test, which is very difficult because you really have to dig and get all the way up to the nasopharyngeal area to get good specimen. And there's a lot of false negative, meaning they do the test, they tell you it's negative, and a few days later, the patients start having all full-blown symptoms of this kind of disease. The other test that we're talking about, the blood test, which is all about antibodies, if you get it early on, it's not going to really show because it takes a few days until you form the antibodies. So it's a big mess and it's a lot of confusion. At the end, I think if the test is positive, it's going to be helpful for you, Greg. But if it's negative, it's not going to help us that much.
Okay, if it's positive, though, if it's positive, yes. I have no other issues. Not over 50, well, kind of. I'm not like, if I get the flu, whether it's COVID or not, I think the guidelines say stay home. I could get a test out of curiosity, but I don't think actually the CDC guidelines require me to get a test or if it's even recommended.
Correct. If you're asymptomatic and you're absolutely healthy and you have no symptoms, there's no reason for you to get tested.
But what if I have a mild flu, like a regular flu? I know people want to know if it's COVID or not, but I've even heard this from the president that there may not be, just because you're sick doesn't mean go get a test.
Correct. And you know what? Majority of us can really go back to work because herd immunity, a lot of people may have this antibody. A lot of people may have already gotten the disease, and maybe it was a day or two of fever or body ache or a few days of cough. No big deal. Everyone had it. You thought it was a flu, and you're protected already. So by having a lot of people out there, and we're starting to find that even from studies from USC, that more people really have this without knowing. These are asymptomatic people with positive antibodies. And that's one of the reasons why state after state is going to open up and people to go back to work